Hey, Margie here. There's a lot going on today, and you may be saying, I'm stressed out. But what you may not know is that stress is not one size fits all. And there's actually 5 different types of stress you may be experiencing. And depending upon the type of stress, that will dictate what's the most effective way to reduce it. And that's what we're going to talk about today with someone I've known for a while and really admire, Dr. Doni Wilson. Dr. Doni is a naturopathic doctor, natural health expert, certified professional midwife, and certified nutrition specialist. In the process of solving her own migraines, Dr. Doni discovered what is now her stress recovery protocol, which she has used to help patients with various health conditions, including osteoporosis, infertility, autoimmunity, fatigue, insomnia, to name a few. Dr. Doni is the best-selling author of The Stress Remedy, which redefines stress to include toxins, food sensitivities, and lack of sleep, and her soon-to-be released book, Master Your Stress, Reset Your Health. For more than 20 years, Dr. Doni has helped women, men, and children overcome their most perplexing health challenges and achieve their wellness goals by crafting individualized strategies that address the whole body and the underlying causes of health issues. Dr. Doni is frequently called upon to discuss her approach in the media, as well as at both public and professional events. She writes a blog you can find at drdoni.com, and her podcast is called How Humans Heal. In today's talk, we're going to go over what you can do to master your stress and what's different about this approach. And she'll talk about the 5 different stress types and how we can use that to really help reduce our stress. So this is filled with lots of great information. So stay tuned. Welcome, Dr. Doni. I can't even tell you how happy I am to be here with you. We used to see each other around every year when we first met at a conference, and I always looked forward to seeing you. But since COVID, I haven't been there live. So it's really a treat for me to be here with you. I love your energy, and I'm so excited about the topic that you're talking about today. It's just so important, and you're the perfect person to really discuss this and shed a different light on it. So thanks so much for being here.
Thank you so much. It's a pleasure to be here with you. I know I've been looking forward to getting to have this conversation for a long time.
Me too. So let's just start. I always like, Doni, to go to the backstory and why you, in your practice, you place such an emphasis on stress and just how that became an important part of your life to deal with, and why it's something with all the people you work with, such an important piece.
It's funny because I ask myself this often, like, why is it that I so much think about stress and have that as such a central concept of of the way I perceive the world and how I help my patients and therefore what I write about for people, and to some degree of course we all have stress experiences, right? From the moment we're born, essentially we have experiences with stress, sometimes in to some degree in childhood, and throughout our lives. And I think, thinking back on it, I mean, my father is a pharmacist and my mother is a teacher, and I remember from a young age my mom saying certain times, if like things were a little bit stressed and my dad was grumpy, my mom would say, your dad is stressed, because she was a teacher. So she was good about putting those words to the experience. And I think in my childhood mind, that made sense. I could make sense of the world from that. And so when I graduated from high school, I went on to get a degree, like a pre-med degree. So I was studying biology and science and chemistry. I also have a degree in nutrition. And so here I am getting 2 bachelor's degrees at once. So I'm putting myself in somewhat of a stressful situation. And I realized I want to study a medicine that includes nutrition, because I really became interested in preventing health issues whenever possible. And that's when I found out about naturopathic medicine and decided to go to naturopathic medical school. I graduated from Bissinger University, and I also studied to be a midwife. So when I was studying women in labor, because part of the degree is I needed to do research, so I could choose whatever I wanted to research. But what I chose to research is how stress affects women in labor, of course, because my brain is always thinking about stress. So I'm going to research women in labor and why we fear labor and what happens when we have a stress, say abuse experience going into labor. And what I learned from women in labor is that we need a certain amount of stress hormones. Our stress hormones are cortisol and adrenaline. We need a certain amount of cortisol and adrenaline in order for labor to go correctly, in order for labor to work, in order for the baby to come out. We need some cortisol and adrenaline. And yet, if we have too much cortisol and adrenaline, if women are too stressed when they're in labor, it comes to a halt. It completely stops. So I was so intrigued by that. Like, what if we could learn from women in labor and apply that? Is that true for the rest of us all of the time? In fact, after I graduated from Bastyr and finished my residency, I moved to Manhattan in New York. And this was right after 9/11. So I came to the tri-state area right when it was the most stressful time for people in a long time. And I said to myself, maybe this is true for everyone. Maybe there's a certain amount of stress, a certain amount of cortisol and adrenaline that helps us through stressful situations. But if we have too much cortisol and adrenaline or too much stress without enough support, that's when the problems arise. And so I kept researching this. I kept researching. I'm a person who I'm reading articles, I'm writing papers, I'm writing books, I'm speaking at conferences, because it helps me to process the information, and it helped me when I'm working with my patients to understand how can I help them and how could I help myself, right? Because I had just come through medical school and learning to be a midwife with no sleep, and then having my daughter. So I was completely burned out and stressed out. So I needed to figure out, how do I heal myself and how do I heal my patients? And this is where I continued on this path of understanding how stress affects us and how to heal from it.
Wow. And,
Mhm.
and it's I see this all the time in my practice, and so many of the listeners have issues with osteoporosis and bone health. And I know you do a lot of work with that. And they sort of look at me like, what do you mean they're so worried about their exercise and nutrition and other things going on, not realizing this is such a big piece. And there's not one person that I work with that I don't address this, because it's absolutely essential. So why don't you tell us from your experience? And I know you've worked with so many people with bone health and, helping them, what you found, and, what the correlation is, and why everybody needs to deal with this.
Well, and the thing with bones is, it comes up even in all of my training, from science, biology, biochemistry to nutrition. There's a lot of focus. When I got my nutrition degree, it's all about how do we eat and give enough nutrients to maintain our bones. And then when I went on to naturopathic school and becoming a midwife, I was especially focused on women and their health. And there's a huge focus, say, for example, during pregnancy, postpartum, and postmenopausally, how do we help women maintain their bones? And so since, the past 22 years in practice, I see patients in all of those areas, during, preparing for pregnancy, during pregnancy, after pregnancy, throughout, especially women as their hormones shift. And we know that we tend to pay attention mostly after age 50, when women have a DEXA, and we see, or when the period stops happening, and we see, okay, how are your bones now? And to me, it's like, that's the first time that we're really kind of getting a look at a person's bones, is when their period stops. Unless they had their period stopping at an earlier age, then we might get it then. But it's like, there's this wake-up call that happens, right? Women get this DEXA back, and then the doctor's going to say, oh, you need this medication because you have bone loss. And the thing is, like, I think a lot of women that I talk to are afraid to go even in for that appointment, right? They're afraid to go for the DEXA because they know the doctor's going to give a prescription. And you and I know there's so many other ways we can support their bones besides just a medication, right? So I feel like I like to reframe and say, hey, try to look at it as, let's just find out where we are with your bones at this moment in time, so then we can know how proactive we can get inspired about helping. Because as you're saying, stress has such a huge impact on the bones. We don't usually think of it that way. We think of it as just, did I take enough calcium and am I getting older, right? And when you go to the doctor's office, those are probably the main things they're going to mention is age and calcium intake. And that's just the tip of the iceberg. That's not the whole thing, right? And so if someone says to me, what's really happening with the bones, I would say it's all about understanding your stress exposures, because stress is not just what we think of as stress. Stress includes our toxin exposures. It includes our dietary exposures to maybe foods that are inflammatory, for example. It includes our how stress affects our digestion and absorption. It includes how stress affects our other hormones in our body. It includes stress in terms of not getting enough sleep, or not getting the chance to exercise. So there's so many ways that stress shows up, and so many ways it affects our bones.
Yeah, and the interesting thing, and I always look at, I agree with you. I look at it as an opportunity. When you get this diagnosis, it's an opportunity, a window into your health, like, oh, to really examine, where am I at? What can I do? And the good part of that, there's such a silver lining, because the good part is, let's just talk about the stress, which we're going to go into in way more detail. But when you address that piece, your life becomes so much better. And so many things, like every issue that you address, then on the other side, you look back and like, you know what, that really was a blessing in disguise, that diagnosis. So I really want to give people, because I can't wait till your book comes out. And I've only read glimpses of things, but I love what you're covering in this book. So you divide it into 5 different stressors. So it's not, which so often, like, you'll go to a doctor and they're like, well, do something to reduce your stress, and then it's like overwhelming, like, well, what should I do? And, there are definitely techniques that help, but let's talk about how you've divided in this book, in your new book, which is out pretty soon.
Yes, this
exciting.
is you see it here. You see a new early edition in over my shoulder here, the Master Your Stress, Reset Your Health. And thank you so much for your excitement about it. I know it's really telling the story of the past 22 years of my practice and my focus on stress and what I learned from it. And thank you so much for asking more about it. It's because the thing is that a lot of times we tend to just kind of say, well, I'm stressed. Yes, I'm stressed. We could all probably agree that we all have stress, which is part of it. I think it's important to acknowledge that we all have stress. We know we just came through a pandemic. We know we all have, different kinds of stresses, financial and relationship, and all the types of stress that show up in our lives. But then what happens is we're kind of left with, what am I supposed to do about that? And sometimes what you end up hearing is things that you can kind of, that as if everyone's the same, right? Like, okay, well, there's some things that we can all benefit from, right? So we can go, oh, well, we can all probably take some deep breaths, and we can all do some meditation, and we can all do some exercise. These are going to help in general. And even sometimes people will go and reach for an adrenal supplement, right? Like, okay, let me take this for stress. Or sometimes people are reaching for alcohol or other means of trying to calm their stress, right? Like, just for listeners, what do you feel when you're stressed? When you kind of in your mind, you go, I feel stressed right now. What do you end up choosing? And sometimes it's something good, and sometimes it's something that might actually create more stress right on your system and for your bones, right? If we're eating more sugar and drinking more alcohol, that's not going to be good for our bones. So we have to be like, okay, if I recognize that I'm stressed, what am I going to do about it that actually ends up benefiting me in the long run? And what I've seen over the years is that it's not the same for everyone, because our body and our hormones, our cortisol and adrenaline, are not the same for all of us. We assume that we all have high cortisol and adrenaline, but that's not the case in my research. We don't all have high cortisol and adrenaline. So to really understand what your body needs to recover from stress, we need to know what I call your stress type. which is like you, almost like your fingerprint when it comes to stress. Is your cortisol going high at certain times a day? Is your cortisol going low at certain times a day? What is your adrenaline up to? Is your adrenaline high or low? When I draw this out and I identified what are the five most common patterns for humans when under stress, that's what I identify in this book. And there's an assessment in the book to help you know what is your pattern that your body falls into when you're stressed, when you're in a stress mode. Because once you know what your pattern is, then you can know more specifically how to help your body recover. The treatment's not the same for everyone.
Wow. I know you go in real detail in the book, but can we briefly go over the different 5 types so people can have a sense? Because you're absolutely right. It's not one size fits all, but it's usually treated as one size fits all. And as you're saying, meditation, breathing, all that's good, but you're taking it to another level in terms of figuring it out so you can have some more tools in your toolbox to really deal with it. So yes, tell us the 5 types.
And the way I think about it is like, if you're trying to get from point A to point B, right? And first of all, sometimes you don't even know where you're starting from. Like if you're in a parking lot trying to find your car, if you have no idea where it is, you're going to be searching a long time, and whatever effort you put in may or may not be successful. But if we can know, hey, here's your stress type, now you know where you're starting from. And if you put in, say you do some general activities to help with stress, it may only have a percentage of benefit. You might only get so much improvement in your health based on that. But when we know where you're starting from based on your stress type, now we can be so much more efficient and strategic about getting you to point B, which is feeling good, feeling healthy, and helping your bones, right? So that's the whole idea, is how can we be most efficient and most strategic about our stress recovery? And so, so the 5 types are, one is a stress magnet, which is the person that tends to have high cortisol and adrenaline. And that might be high cortisol at even we test the cortisol different times a day: morning, middle of the day, evening, and bedtime, because it varies. It's one of the only hormones that changes through the day. So we can't just test it at one time. We got to know, what is it, the morning, midday, evening, bedtime. And if a person has high cortisol at any one of those times, along with high adrenaline, then their recovery process means that we need to first bring their cortisol and adrenaline down. We need to take specific strategies, herbs, nutrients, and even stress recovery activities that help bring the cortisol down to optimal, not to zero, right? But to optimal. Now, another stress type is the opposite of that, having completely low cortisol and adrenaline, which is, by the way, when I first tested myself back when I finished my training, that's where I was. I was completely low cortisol and low adrenaline. And by the way, a lot of practitioners only test cortisol. But in my research, what I found is you really also need to measure, if you're going to do a test, and these are tests you can do at home and specialty tests you can get through a practitioner, not through the general practice, right? It's going to be a specialty test, but you can measure your adrenaline and urine. Now we have another piece of the puzzle, so to speak. If we only know your cortisol, then that still isn't, to me, good enough. I'd rather have as much information as possible. So if both cortisol and adrenaline are low, this is a blah and blue type, you're much more likely to feel fatigued and unmotivated and hard to get through the day. And so that's a completely different treatment plan. We're going to need to help bring your cortisol and adrenaline levels back up again. We want your adrenal glands, which is where the cortisol and adrenaline comes from. We want to heal them so they can do a better job of making cortisol and adrenaline. And so it's a totally different approach. Whereas there's the night owl, who tends to have high cortisol and adrenaline at night. So if you're a kind of person where you're, all of a sudden you get a second wind at night and it's hard for you to fall asleep, or you're working late, then likely you're a night owl. And we need to help bring your cortisol and adrenaline down, but not during the daytime, at nighttime. So we're going to do our dosing based on the time of day that your cortisol and adrenaline is high. See, so it really shifts the treatment plan. And then there's the sluggish and stressed, which has high cortisol, low adrenaline. And there's tired and wired, which has low cortisol, high adrenaline. So it's possible to have opposites. And here again, what we need to do is a totally different treatment plan. We have to, in the case of high cortisol, we need to bring that down first. High adrenaline, we need to bring that down first. Then we can address the ones that are too low. And so it's, to me, it's a completely different protocol for each of these stress types. And if a person doesn't have that information and isn't approaching it that way, they're very unlikely to really get the benefits of whatever else they might be doing, right? Like you might be doing things that are potentially going to be helpful for you, taking vitamins, exercising, meditating. But if you're not addressing your stress type, you might feel like you're just like, a lot of times people come to me and they're like, I'm doing this stuff, I'm eating healthy, I'm exercising, but I'm still tired. I'm still anxious. I'm still not sleeping well. I'm still having bone loss. You're bloated. Why can't I feel better even though I'm doing this good stuff? Well, here's my answer is you probably haven't addressed your stress type. You haven't helped your cortisol and adrenaline get back to optimal, because here's the thing is cortisol and adrenaline affect everything else. So we can create this positive ripple effect, right? Once we have cortisol and adrenaline where we want them to be, now we have better signaling to our digestion, to our hormones, to our nervous system, to our immune system, and all of those are important for bones.
Yeah. And they've even, I mean, now there's research, animal and human, how, increased reduction, if there's too much cortisol, it actually affects your osteoblast, the bone building cells. So there's a direct correlation. And this is so very interesting. So in terms of testing, Doni, can people, when people are reading your book, then do you outline, like, when you said there's questionnaires so they can get a sense of where they are? And in terms of testing, are there certain tests you personally like or you use that you want to share? Or
so someone could start with the book. I'm also developing an online quiz, so you could do an online version of it to start to know your stress type. If you really want to know exactly what your cortisol and adrenaline levels are, then you would want to do, work with a practitioner, or I also offer this through my programs where we can send you the test kit so you can measure now cortisol. We can either measure in saliva or urine. So there's a couple different labs that offer that. And we can either use like the Precision Analytical Dutch urine panel to measure cortisol at different times a day. I also like to use a lab called Senesco because they can do cortisol in saliva different times a day. And that's the lab where I like to measure adrenaline levels in the urine. And so then it's so amazing when patients receive these results, right? You feel like, oh, it's like your mirror, right? Like you open, you're like, oh my gosh, this looks like me. That's what they say to me. They're like, this makes so much sense. But if you don't have it in front of you, like if you don't have a mirror, you don't know because you're just living it, right? But when you have a mirror, you're like, oh, that's what I've been feeling. And so it's so eye-opening. Then you feel this excitement to be able to help yourself out based on this information.
And I think the other thing, unlike bones that take time, you don't see instant results. How long would you say then when they redo the test, they can actually see a difference, which is exciting.
Well, and it does vary based on, some people, it's going to be a little bit longer path than for other people. And I, in the book, outline my 3-phase stress recovery protocol, because it's important to know that it's not something that you're just going to fix in a week, but we need to go through a step-by-step process. And it's going to be, because our goal is not just fix it for now and then have to come back and fix it again next year. My goal for you is let's resolve this and get you into what I call resiliency. We want you to, how do you maintain a healthy relationship with stress ongoing through your life, no matter what stress comes along? And so if we want to get to resiliency, that may take 3 to 6 months, I would say. And I just love, when like, say with bones, for example, when because the DEXA we usually do in say 2 years. So you're kind of waiting for 2 years to see if your bone density improved. I don't know if you also measure the CTX, like the collagen peptides.
Yes, absolutely. The bone markers. Sure. Yeah.
I love that because we can do those sooner. So what I've seen is like we help manage the cortisol and adrenaline. and maybe we measure the CTX or the telopeptides before they start, and then maybe 3 months and 6 months in, and I see such an improvement. Right now, you're having a decrease in your bone loss based on correcting your relationship to stress. And then we can figure out how to maintain over time, which is what we really need for bones, right? We need them. It's about what we're exposed to day in, day out over years and decades. That's
Absolutely.
right.
We want our bones for life. There isn't a quick fix, and we don't, that's not what we want. But what you're talking about is lifestyle and changing habits. And when we do all of this, that's what I said, that silver lining, so many things get better. But what I find so interesting, because of your emphasis on stress, and just explain to everybody in case they don't know about the bone markers, because these
Yes.
are amazing what they show. So you want to just tell everyone about that. But what I just want to say is, that's fascinating that when you just address the stress piece, you've seen changes in bone markers. That's amazing, Doni, because a lot of, most people don't really, or do a lot of different things and maybe they change, but since you spend such an emphasis on stress, that's fascinating. All right, so tell just do a quick thing about the bone markers for those people listening that don't know exactly what they are.
Sure, sure, of course. And it's so cool. This is one of the things I love to do as a researcher, as a clinician, is I get to see patterns, and when I get to see, oh, I'm working on stress, and so I see these levels, and we're also working on the bones, so we can see the levels, we can see the change, and it's so exciting. So there's different ways you can measure these C telopeptides. It's a collagen marker that you can measure it in urine and you can measure it in blood. I usually now measure it in blood because it's easy for me when, say, a patient is going in anyway to check on, say, thyroid and blood sugar and vitamin D. Then we'll also measure their C telopeptides on a lab. It's usually called CTX. And to me, and I've measured all kinds of different bone markers, by the way, in different ways over the years, from urine, and I've measured all the, sometimes we were measuring 10 different things. And what I saw is that consistently, the thing that gave me the most information is the C telopeptide. So that's the one that I tend to go to first. If I'm going to order one test to help me understand how a person's bones are doing, it's the CTX panel. And I just run it on regular blood work because insurance should cover it. So then you're not even having to pay out of pocket for that, right? You're getting your insurance to cover, and helps you get a quicker answer. What you want is you want a essentially lower number. Like I usually look for under 500. If it's over 500, we know you're having active bone turnover. And so that means you could be losing bone. But if that number goes under 500, we know your bone turnover is decreased, so you're maintaining more bone. And so that's what we get excited about. And then it correlates. If then once you do go to the DEXA, we see improvements in the bone density that goes along with it. So we can see how it correlates that pattern.
Yeah. And the other thing I think so helpful is a lot of times, people get one DEXA, and, maybe as a child, they just didn't develop a lot of bone. So they're not actively losing bone. And there's such a difference in that person than someone. So yeah, it's great information, but I love how you're correlating it with also looking at the adrenaline and the cortisol. That's fabulous. And that you see a difference. So all this stuff, everybody, this is really important. So important, but that's great.
Well, because I know that so many people might go to their doctor and the doctor might say, well, related to bones, I don't know if doctors ever mention stress. Sometimes they mention it related to like heart disease risk or, anxiety. They might say, oh, maybe you're stressed, but the doctors don't usually mention it related to bones. And I think it's such a huge area that we can do something about. Like we want to be able, you don't have to just be resolved that you're losing bones and that's just the story of your life. You don't have to be stuck there, right? You can actually decide, hey, there's some things I can do that can actually improve my bone density. It's not a medication that has side effects that actually also ends up, like you said, improving your whole health. Because as we know, when you improve your whole health, your digestion, your immune system, your hormones, when you improve your whole health, your bones end up improving too.
Yes, yes, they're not in isolation. You're so right, though. They don't, you're right. Certain things they'll say, oh, you're stressed. Yes, with cardiac issues, but they don't say that. I don't think I've seen. And when I tell people we have to deal with this, they look at me like, really? That this really has an effect. So I love all the things you're doing and that all the years that you've worked with patients, what you've seen, that's great. So let's talk about, okay, so there's 5 different types. And let's talk about, you have a C.A.R.E method for recovery. You want to just share a little bit about that with us?
Yes, definitely. So part of the stress recovery involves, I think of it as your foundation of self-care. And so if we use CARE as an acronym, the C would be for clean eating. So, and then the A, I'll go back and explain a little bit more of each one, but C for clean eating, A for adequate sleep, R for recovery activities, and E for exercise. So it's a nice way to, because like if you wake up in the morning, you can say, am I doing my self-care, or what could I do today that's going to move to be a little better care for myself, right? Maybe am I going to, in terms of clean eating, maybe it's reducing sugar intake, reducing pesticides and toxins, choosing organic, choosing to eat in a way that's going to be more matching your physiology, and potentially then fasting overnight, right? Giving your digestion a break overnight. So there's things we can do to improve our diet that's going to be overall beneficial to our health and our stress recovery. And then the A is just asking yourself, hey, am I getting enough sleep? Am I getting 7.5 to 9 hours of sleep? If not, what steps do I need to take to help ensure that I get those 7.5 to 9 hours of sleep? Because as you know, it's our bones also are paying attention to how much we sleep, right?
Yeah,
They
everything.
notice.
Sleep is just your happiness. Everything is determined by your sleep. So that's a huge piece of it,
It
everybody's
is.
puzzle. Yeah.
Oh my gosh, the research is so much, and we tend to, if we're under stress, we tend to eat foods that are going to stress our bodies out more, and we tend to sleep less. So we end up stressing ourselves more when we're stressed. And so I just want you to just kind of, yeah, laugh about that and go, oh my gosh, that's such a human thing to do, is we end up not giving ourselves what we need when we're stressed. And so just kind of go, okay, if I'm under a lot of stress, like say maybe you have a deadline, or you're moving your home, or your relationship just ended, or someone maybe died in your family, or you lost your pet, you're under stress. So then say to yourself, this is when I need more self-care. I need to pay more attention to what I'm feeding myself. Am I getting enough sleep? The R is for recovery activities. So in the book, I go through all the research on a whole menu of recovery activities, everything from deep breathing, yoga, meditation, to spending time in nature, having some quiet time to yourself, journaling, communicating with someone, a friend or a therapist, like there's so many different recovery activities we can choose. But my interest was, when I reviewed the research, and there's hundreds of references in this book, if any of you like to read more of the references, but what I was looking for is when we research biofeedback or meditation, are they telling us for which stress type, right? How should meditation be done for someone with high cortisol, high adrenaline versus someone with low cortisol, low adrenaline? And there's some research in that way, but my hope is going forward, when we research recovery activities, it really should be based on the person's stress type. We need a study for stress magnets and meditation, and how should they meditate versus a blah and blue, and what should meditation be for them, because I think that it's going to be slightly different. And so in the book, I did my best based on the research that's available to say, hey, if you're a stress magnet, here's how meditation should look for you to get the most out of it, versus someone who's tired and wired, how should they meditate? And this, I think, can really, again, optimize your stress recovery. So
Wow.
anyway, yeah,
I
right.
love this because we all have X amount of time and we want to do what's most effective and we want to put the time in, but why not figure out that? I love how you've divided it. So if you're this type, this is what you should do to really move the needle. So yeah, this is really terrific, Doni. Love it.
And the same with E. E is for exercise. So how should each stress type be exercising? How long, what time of day, what type of exercise, right? So that when you're going into exercise, you're actually choosing exercise that's going to match best for your body and what it needs. Versus because here's the thing is if we exercise too much, we raise our cortisol again, which then is not good for the bones, and it's not good for the whole rest of your body either. You don't want to, if you're trying to do something good for you, you don't want to end up causing a problem, right? You're doing it with the good intentions. So how do you make sure that even when you do something good, whether it's exercise or meditation, that you're doing it to match your body system? And I teach you how to really listen to your body, how to check in with your body. And I also teach you at the end of the book, I teach you how to create a self-care routine based on your stress type. So how are you going to fit these different activities into your day in a way that's going to be most supportive of your health? And I call that your self-care routine, and it takes a little bit of trial and error, right? You might have to try this, see how it works. How are you feeling? How's your bones responding? And then, okay, let me tweak it. Let me try a little bit different exercise at a different time until we figure out your best self-care routine, because it's your self-care routine, right? Your diet, your sleep, your recovery activities, and your exercise over time that's going to also help create I would say like a buffer between you and stress. We know the stress is going to happen, but we need you to be able to withstand it and bounce back from it. And it's these care activities that build that for you, that cushion.
Love this. I can't wait to read the book now. I can't wait for it to come out and read everything, because, you bring up so many important points. But when it comes to the bones, it is an issue, because what increases bone density is very intense exercise. And so a lot of people, well-meaning, may be very stressed out, and they're like, I've seen this. Oh, I have to go on the treadmill. And they're sending all these, when I'm big into happiness, all this negativity with the exercise. But a lot of times people are overdoing it, increasing their stress. So there's a huge balance of doing, the exercises to achieve your results, but doing it away with breaks and, other things, so that you're not getting this increase in cortisol, as you're mentioning, because that does happen. And, again, well-meaning people, which breaks my heart, because you're trying to help yourself, but yet you're then increasing your stress. So this is great. But what I also like, Doni, is that you've now, besides the book, so someone gets the book, you have other things. Explain that, because you have other things that they can, part of that, right? When they buy the book, there's some other tools that you're offering to guide people on this journey.
Yes, because the book is available where you would usually order books, maybe Amazon or another bookseller. And then if you come to my website, to drdoni.com.
And we'll have the links in the show notes and everything.
Okay. And then you let me know that you ordered it, because then I'm going to give you all kinds of support to get the most out of it. I put so much love and intention into this book for those of you who really have been looking for this kind of information. And so I want to help you get the most out of it. So there's recipes in the book, by the way, that are clean eating recipes. And when you let me know you ordered the book, I'm sending you the recipes in a PDF so you can use them right away. I also invite you to my live stress reset. We're having the live stress reset the first week of May. So I'll be guiding you how to implement this self-care. I really want you to be able to understand how to do this in incremental steps. And then also my introducing you to my self-care program, where we just go from there. If you want to be able to check your cortisol and adrenaline levels and know how to address them, we're going to guide you from there. So yeah, definitely come. And when you order the book, come tell me you ordered it, so that I can give you more support and guidance. And I'm also thinking to create a book club.
Oh, wow.
So yeah, if people are, interested in that, let me know, because I'm thinking then we can read chapter by chapter together. And that makes it kind of fun and interactive, right? Where we can all be in it together.
So they just go to drdoni.com and we'll have the link and everything's there. Oh, that's great. So is there any, if there's one thing, because everyone's listening, is there one thing, I know there's different stress types, but what would you say to everybody listening? What's the first step? So besides getting the book, because the book sounds like there's so much amazing information, but what would you say to everybody? One thing right now, like right after you listen to this, what would you recommend that people can do that maybe would be something global or that they could get started on? Or
well, I love this. I mean, I think I could probably think of a bunch of little first things.
well, you can say a couple if you want, but yeah, just so people can leave really something to I love giving action steps, something they can start.
Absolutely. I mean, I think just as you're listening, take a moment, even as we wrap up, pull out like a journal, a notes. I'm creating actually a journal for people to take notes about their self-care, but pull out whatever piece of paper or wherever you type notes for yourself and just do a check-in based on listening to this. What is it? How are you feeling right now in terms of your stress and how stress is affecting you? I ask people to look at their energy level, their mood, their focus, their sleep, and any other symptoms you're having in your body. Just do a self-check, because so much of this is self-reflection and self-acceptance. You know, we tend to have this critical voice that's criticizing us and telling us we're not doing it good enough and not enough and not well enough, all of that, right? And then we're just stuck. We're not going to do anything. We feel helpless and hopeless and afraid. So I want you to take this chance to just go, okay, let me set that all aside and just give myself the self-reflection and self-compassion to say, it's okay. I'm human. I've been exposed to stresses like other humans, and I get to forgive myself and give myself the support I need to recover and go forward from here. No matter what age you are, no matter what stress you've been exposed to, no matter where you're starting from, you can take note and say, hey, at this moment, I'm ready to give myself even little incremental steps of recovery, and just, journal about that, because then you can, from there, now you know where you're starting from, and you can find out your stress type, and you can start to implement little by little, and you start to become more aware in each moment when stress starts to happen. Now you have your center point. Now you know, here's where I am when I'm feeling calm and I'm feeling centered and I'm feeling compassion for myself. Now I know where I'm starting from. And whatever stress comes along, you get a phone call about this or a text about that, instead of it pulling you immediately away from yourself, you can say, wait a minute, okay, that's something stressful popping up. I can feel my cortisol and adrenaline responding, but I can also choose, how am I going to support myself through this stress? Do I need to get a drink of water? Do I need to eat? Do I need to take a supplement to help calm my nervous system? What do I need to do to take care of me while I'm handling whatever stress just came up? And I think that practice of self-reflection and bringing ourselves back to center can make such a difference whatever stress comes up. I mean, I'm remembering, like, even just my daughter's now 19 years old and she lives in Manhattan going to college, and I get so excited to go visit her and help her out there in her place. And I when I went the other day, she was feeling so stressed about her classes and her apartment, and she had all of this stress that she was experiencing. And in the moment, I get to choose, right? As a person and as a mom and as someone who specializes in stress, here I am with my daughter experiencing stress. And I think to myself, what am I going to do in this moment, right? If I end up going into stress and fear with her, then we're both in it and it's not going to go smoothly, right? What if I just take a minute and just breathe and listen and have compassion for myself and compassion for her, and we can actually then do some problem solving, and I can listen to her feelings and I can help her solve what needs to be solved so that she can move through that stress. And wouldn't that be amazing if we all have that, someone who, when we're feeling stressed, that presence that's just there for us and say, hey, you're okay. Everything's going to be okay. Let's have compassion for what you're feeling and figure out how to help you solve it. And so that's what I'm I'm hoping to help you learn how to be that for yourself, and by guiding you in this book and everything else that I offer.
Oh, this is great. And you're
Mhm.
right, because we just sort of go and we don't take that minute. We don't take that minute. I love the assessment and the journaling and to see where we're at. And then we can see our progress. Plus, we're aware so that we can stop ourselves. Just like you say, do the practices. So, yes, that's a fantastic place to start. Well, I can't thank you enough. Is there any last minute thing before we end? You've given so many great things, and I'm so grateful for you in doing all this research for the book. It's certainly something that I'm going to read and pay attention to, because you've brought up so many interesting points that we can't, it's not one size fits all, and why not be as effective as we can with the techniques we choose. So
Exactly. And you matter. I think sometimes we're so used to taking care of everyone else and being responsible for everything we're responsible for, that we kind of lose track of ourselves in the mix of that. And so it's a matter of saying, you know what? I matter. My health matters. My bones matter. What do I need to do in this moment to kind of realign my day and my priorities so that it reflects that it reflects that you matter, and you're supporting you through whatever stress exposure matters.
that's a great way to end. And it's been such a pleasure, as always, being with you. So thank you so much for taking the time. And thank you for really all the work you've done on this book and all the research and, sharing this with all of us today. So thanks so much. One more thing, Doni, before we end. I know you work with people. Can you just tell everyone how you work with people? Because besides the stress, you can also help with the osteoporosis. You're a resource in many ways. So why don't you just share how people can work with you?
Definitely. I work with patients one-on-one, either in person. I'm in the tri-state area and Arizona, but also many patients work with me by phone and video from around the world. And I also have online group programs. So if you're wanting more help from me to address your bones or to address your stress, then just reach out to us, and we'll find the best fit for you.
Okay, so they can just go to your website, drdoni.com.
Mhm.
Okay,
Yes.
fantastic. Well, thank you so much for being with all of us today and sharing your wisdom. And thank you for all the work you've done and really made a big difference. I can't wait. I'm very excited about your book. I can't wait to read it. And I know it comes out really soon. So good luck with everything. And thanks again for being here with all of us.
You're welcome. Thank you so much for having me. I really appreciate it.
Oh, my pleasure. And hopefully we'll see each other before another 3 years.
Definitely.
Thanks so much. I love talking with Dr. Doni, and I hope you enjoyed the interview and now have a better understanding of the 5 different types of stress and why it matters, why we need to delve into it a little further in order to find the most effective remedy. All the links Dr. Doni talked about, including the link to her new book, will be in the show notes. And make sure to go to drdoni.com if you do purchase the book so that you can get all those bonuses she talked about. So thanks so much for tuning in, and I look forward to seeing you on the next episode.